Okay, today we're going to start looking at the microscopic pieces of the urine. So from this point, we have learned about the physical characteristics of the urine. So we looked at odor and we looked at the color and the clarity of the urine. From there, we looked at the chemical composition of the urine, everything from bilirubin, glucose, specific gravity, pH, and those types of things. So now we're going to look at what we would see underneath the microscope in a urine. The next time you come to class, this is something that we will be performing. We will be taking the urine, we will put it in a centrifuge that will concentrate any of the cellular constituents to the bottom of the tube, and we will look at those cells and things that are at the bottom of the tube underneath the microscope. So that's pretty much how that's going to happen. All right, I'll switch my slide here. Okay, so after recording the physical and chemical findings, usually we do a microscopic examination of your urine. Not always. Okay, this isn't a given. Some doctors or clinics, are just fine with the chemical dip and not having us look at it under the microscope, particularly if everything is normal. But if anything is abnormal, some people or some physicians would like to see what is under the microscope within the urine. So we have two parts of this urine. We are going to put the urine in a tube, we're going to centrifuge it, and that'll push all of the sediment or cells to the bottom of the test tube. The supernatant is the liquid that is left above this, the sediment that's at the bottom. We're actually going to pour that off and not use the supernatant. We're going to look at the sediment. So there's three things that we're typically going to be looking for. Cells, such as red blood cells, white blood cells. We're going to be looking for casts, which actually take the shape of the tubules up in the nephron, and certain types of crystals, which can solubilize and come out of the urine depending on different pH. So the first one we're going to look at are red blood cells. When we have red blood cells in the urine, we refer to it as hematuria, not to be confused with hemoglobinuria, which we'd see in a clear red urine. The presence may indicate bleeding. Okay, so they're usually round, they're biconcave discs, they look like little donuts in most cases. They shrink in a very concentrated urine, but they will swell and get bigger in a really diluted urine. So a concentrated urine would have a high specific gravity, and a really, dilute urine would have a really low specific gravity. The next cells are white blood cells. We find these with infection. So white blood cells in the urine probably mean that there's some type of an infection in the gastrointestinal system. It can be a result of having a fever or strenuous exercise. It can be found in pyelonephritis, which is a kidney infection. Cystitis is a bladder infection. Prostatitis is a prostate infection. Urethritis is just an inflammation of the urethra. These look different than the red cells in the fact that they are kind of glittery. Okay, so when you see them in real life, especially in a urine that's got a low specific gravity, they actually kind of shine and sparkle, and you can kind of see they look a little bit grainy. These will actually be sparkly underneath the microscope. The next type of cell is actually a skin cell. It's an epithelial cell. So squamous epithelial cells are the most frequently seen and least significant cell we could probably find in the urine. Many of them come from the lining of the vagina and lower portions of the male and female urethra. So everybody has skin cells, right? This is why it's really important to do a midstream clean catch urine. If the patient starts urinating, it's going to flush away any loose epithelial cells. So when we catch the mid part of the urine, all of that contaminant will be rinsed away. So while these are normal, if there's too many of these, it clouds what we can see. So if there's any red cells, bacteria, white cells, sometimes there's so many epithelial cells that we really can't even see what's behind it. That's why we need a clean catch urine. So they're very large. They have a ton of cytoplasm with this little tiny nucleus in the middle. They're very distinctive. We will be seeing these in our urine when you guys come back to class. Next, we have renal epithelial cells. These come from up higher in the urinary system. They come from the lining of the renal pelvis, the bladder, and the upper urethra. They're smaller than squamous cells. Sometimes they have a tail. They can be pathologic if there's a lot of them. It could mean that there's kidney issues. So here's a picture of what they look like. They kind of look like fried eggs. They're bigger than a white cell. So there's white cells over here. They're smaller than an epithelial cell. They have kind of a thickness to them. They look very coarse, okay? It can mean renal damage. This is something that we're very careful to report in a urine on patients because we don't want to be leading a physician down the path of renal failure if that isn't in fact the case. So we have to be careful if we're going to call these that we're for sure that that's what it is, okay? They can be found in severe pyelonephritis, a toxic reaction to certain types of drugs, maybe a viral infection, an allograft rejection, which would be like a kidney transplant rejection, and certain types of glomerulonephritis, which is like an inflammation of that glomerulus. Kind of just gets, I guess just inflamed is the best word to use, and proteins will start making it through. We can even have bleeding of the glomerulus, which would cause some issues that we're going to talk about next. So next are casts. These are formed up in the distal convoluted tubule and the collecting duct. They can give us a microscopic view of conditions that are happening up in the nephron, so that can be very helpful. So the shape's usually have parallel sides and some rounded edges, and there's 4 factors that can cause casts to form. I'm going to show you a picture of them here in just a minute. Having decreased urine flow, so let's say you're dehydrated, okay, not going to the bathroom much. Increased acidity. Increased solute concentration, which would mean having a high specific gravity, and having increased plasma proteins. So here's what they look like. As they form up in those tubules, they kind of, it creates a cast of that tubule, which is why they're called a cast. They're held together by something called Tam-Horsfall protein. And if you look up in the top left-hand side, the hyaline cast is what we're going to talk about first. A lot of times these are normal and you may see 1 or 2. What's causing this shape is that Tam-Horsfall protein. As other things are happening up in the kidney, we can start to see cells and things get stuck within that cellular matrix, and then we can give it a title. For example, there's white blood cell casts, red blood cell casts, and we can tell what they are just by looking at them. So we're going to run through each of these individually. So the first one that I mentioned was the hyaline cast. That was the one in the top left-hand corner. That was pretty see-through. These can be normal after strenuous exercise, maybe dehydration, a little heat exposure, and some stress. It can be pathological in acute glomerulonephritis, which is the inflammation of the kidney, pyelonephritis, which is an infection of the kidney, and renal disease and congestive heart failure. Congestive heart failure is very hard on the kidney. It adds a lot of pressure to it because the heart is trying as hard as it can to try and get blood through various vessels, and it's just really hard to force that blood through those, the glomeruli. The next one is a red blood cell cast, okay? And some of these you can see in your textbook as well. Red blood cell casts are a cast. They're kind of orangish red color, and they have red cells inside of them, okay? So you can actually see all those little red donut type cells inside of the red blood cell cast. That would be found in glomerulonephritis. White blood cell casts are casts full of white blood cells. And we can see those. Remember, those are the glittery ones that have the little sparkles in them. This could mean an infection or inflammation within the nephron. We call that pyelonephritis. Now, whether you have red cell casts, white cell casts, after they sit up in the nephron for a period of time, they start to break down. When they start to break down, we call them granular casts. So granular cast is pretty much an old cellular cast. So this is from extreme urine stasis. This is from the urine just kind of standing still up in those tubules. This can be found in normal and abnormal conditions, such as stress and strenuous exercise, just as the hyaline casts were. But these can also be seen in nephrotic syndrome, which is what I call kind of a dumping syndrome, where the floodgates just kind of open up in the kidney and everything comes through. Orthostatic proteinuria, which is where people end up with protein in their urine between laying down and standing up. And congestive heart failure. As a granular cast sits there even longer, so we're talking weeks, okay? It can turn waxy, which it actually kind of starts to petrify. So as it sits there for a really long period of time, it will become blunt and cracked. And I'm going to scroll back up for a second up to our slide full of casts to kind of show you this progression as it goes through. So we're just going to come back up here for a second. So here's the Hyland cast, okay? It progresses through. We can have, just a variety of those. But you see the cellular cast, we can see there's actually some WBCs in here because they're granular, okay, inside the cell. As it sits, it's going to start to just break down and just be a granular cast. We can't tell what type of cells are in there, okay? Over time, as that sits even longer, it's going to get real hard and shiny like plastic, like you see in this waxy one down here, okay? So I just wanted to kind of show you that a cellular cast can turn into a granular cast, can turn into a waxy cast over time. All right. The next part is crystals. These are the prettiest part of a microscopic urine. These are refractile, so they're shiny, and they can be caused from various things. There's a lot of fun things that can cause these to happen, and I'll talk about these as we go. Now, we can classify crystals based off what pH we find them in. Certain crystals are found in an alkaline pH, and certain ones are found in an acidic pH, okay? That is definitely the most important factor in identifying crystals, the pH, okay? Most of them are normal, but there are some abnormal ones, which we'll see on the next slide. Normal ones can be caused just depending on your diet and what you're eating, depending on how old the urine is, okay? Again, depending on the pH of the urine. Abnormal ones can be caused from a variety of things, like bilirubin if you've got liver failure, cholesterol if you've got maybe some nephrotic syndrome and you're dumping proteins and fats in your urine, cysteine with a disease called cystinuria. Leucine is an amino acidopathy type issue. We have one that's actually called maple syrup urine disease, where the baby's diaper smells like maple syrup. We might see those in that case. Tyrosine and sulfa from drugs, which is a type of antibiotic. Acyclovir, which is an antiviral. And indinavir, which is very similar. So certain drugs can cause them, as you can see from these last three, but also different types of diseases can cause crystals as well. You don't really need to be overly familiar with all of these and what causes them and what pH they're found in, but just be aware of the fact that there are normal crystals and there are abnormal crystals. They are all dependent on pH of the urine, whether they're there or not. All right, so let's look at uric acid crystals. These ones typically have four sides. They're flat, yellow, reddish brown. We can see them in leukemia and especially people with gout. Okay, so going back up, uric acid is this one in the top left corner here. Okay, so gout is something where people have difficulty processing purine nucleic acids from the breakdown of like DNA and things like that, just a normal cellular process. And that stuff can build up in your joints and cause gout, which is quite painful, but we can also find those crystals in the urine with those patients. The next ones on this slide are in acidic urine and are actually considered normal. So acidic urine is usually having a low pH, usually around 5 or 6. It's usually below 7. Amorphous urates are a big reason as to why I like to run a urine when it's hot off the press. So the second the patient goes to the bathroom, I want to get the urine in my hands within the next 10 minutes. If it sits for too long, the urine will actually start to turn kind of pink and look like somebody poured Pepto-Bismol in it. No joke. And this is normal. It doesn't mean there's something wrong with the patient whatsoever. If we let it sit in the refrigerator, these crystals can start to form and it makes our job a little bit more difficult under the microscope. Okay? You can try to warm it up, underneath a warm sink by putting the cup under some warm water. That doesn't always work the best. It's always best to get a fresh urine if you can. Calcium oxalate crystals, these ones look like an envelope. They have an X on them. These are associated with diets with high oxalic acid and after large doses of vitamin C. We find some fun things with these, and you don't have to know this, but calcium oxalate crystals will form in the urine of people who have drank antifreeze. It's called ethylene glycol. Dogs love antifreeze, so we'll get like vet samples from time to time where if antifreeze spills out of a car engine, and a dog is there, a dog will lick it up because it tastes really sweet. This is very damaging. It causes these crystals to form in the kidneys in large amounts, and it's also just hard on the dog as well, and it can actually be deadly. So if we see those calcium oxalate crystals, that definitely is a sign that they could have drank antifreeze. And little fun trivia, they actually give the dog or the human an IV of alcohol because alcohol will break down those crystals. So they get you a little bit loopy if you overdose on that by giving you alcohol right in an IV. All right, so these next ones are crystals we find in urine with a high pH, where the pH is greater than 7. Okay, the first one is triple phosphate. We call these coffin lids. This is in a very alkaline urine that contains urea splitting bacteria. So I've seen these in older urines per se. So usually you don't find this in a nice fresh urine. They do look like the top of a coffin. I'll go back up so you can see right here. Okay, this one. See how it kind of looks like the top looking at a coffin from the ceiling down? Kind of looks like that. The next one, amorphous phosphates, is just like the amorphous urates. It's just forms after sitting, especially in the refrigerator. If it's got a low pH, it'll turn pink. If it's got a high pH, it can turn white. Again, it makes it cloudy and difficult to see what it is. Some other abnormal crystals. We have cysteine crystals, leucine, tyrosine, cholesterol. Those are some of the other ones that I showed you before. Sulfonamide crystals could be from antibiotics. So just know those are abnormal. Those would not be something we'd normally find in everybody's urine. Another thing we see, bacteria. So we talked about white blood cells being in a urine with somebody that has an infection. We talked about nitrates being positive. They may also have bacteria that we can actually see. Okay. So if it's a good quality specimen, there shouldn't be a lot of bacteria in there. But if it's got a lot of epithelial cells and a lot of bacteria, it could mean it's a dirty catch because just naturally the vagina has a lot of bacteria in it. It's got a lot of white cells in it. And it's got a lot of epithelial cells. So if we see a urine with a lot of epithelial cells and white cells and bacteria, we assume it's contaminated. If it's just bacteria and white cells, it's probably a bacterial infection. Okay. If the urine is not refrigerated, bacteria will reproduce very quickly. So we have to look at it, as soon as possible. They can have various shapes, and we report it as few, moderate, or many, because a few might not really mean anything, but many is usually very significant. All right, the next one is yeast. These are pretty. They have little buds. They kind of like bud off of each other, okay, and form these little chains. So these are important for a couple reasons. While yeast can cause a UTI, it's not incredibly common. The majority of cases that we see yeast in the urine is because the woman has a yeast infection and it rinsed off into the urine cup. So we're able to look under the microscope and say, okay, this patient has yeast in their urine. They may want to investigate a possible vaginal yeast infection, or in rare cases, it could just be growing in the urine as well. Patients with diabetes and immunocompromised patients really struggle with a lot of yeast infections, so we see this a lot in diabetic patients. Okay. All right, the next one's kind of fun. This is known as Trichomonas vaginalis. This is a parasite that we can see in urine specimens. It's not in the urine. It's usually rinsed off from vaginal secretions. They have a tail on them, so they kind of swim around and they whip around. It creates a very, very itchy, frothy green discharge. Sounds disturbing, but it's incredibly true. Usually patients will come right into urgent care when they have this because it makes them incredibly uncomfortable. We look under the microscope and sometimes in the urine we'll find them. They don't live real long in the urine, but they can also collect a vaginal swab that we can look at and we'll find these as well. As you can see, they move around very quickly. They're kind of entertaining to find. Not so much for the patient, but if you're working in the laboratory, they're always a neat find. All right, sperm. We do see sperm. So this can be found in both the male and female urine after sexual intercourse. In older men, these can be pretty diagnostic. In most cases, a young 20-year-old male or even younger, we don't really care too much. But if you have like an 80-year-old man with a ton of sperm in their urine, it could mean that they have some type of a prostate inflammation that's causing sperm to actually back up into their bladder rather than being, excreted normally. Okay, I don't think excreted is the word I want to use. But there shouldn't be a lot of it in their urine. Okay, if there is, it's a good thing for the doctor to know. Another one is mucus. So with mucus, sometimes there's glands, there's epithelial cells. Sometimes the genitourinary tract can create it. Sometimes renal tubular epithelial cells can produce it as well. So they're thread-like substances. They're not usually clinically significant, but we do report it when we see it. In addition to everything I just showed you, we have some other things that we see in the urine that really are not clinically significant. And these are the types of things that will have students calling me over. When you guys look at your urine under the microscope, you'll be like, oh my gosh, what is this? Oh my gosh, what is this? And majority of it is this stuff, okay? So fecal contamination, that just looks like a bunch of garbage, which is why we have to make sure we clean well with the wipes and collect a midstream clean catch, okay? Starch granules, air bubbles, oil droplets kind of all look like this top row. Pollen grains, that's pretty rare, but we can see those in there as well. Hair and fibers. These are the ones that have students calling me over the most and ask me if they're cast. Is this a cast? I'm like, no, casts don't have these long lines in them. Okay. They're usually more granular. We can also find clothing and diaper fibers. There's starch granules from like baby powder. So those types of things we'll see as well. All right, so it'll be fun. In a couple weeks, we're going to look at our own urine and see what types of things that we find. Usually everything we find is normal, but you should be able to see some cellular constituents in there for sure. Have a great week.